everyone, I'm Dr. Meeta. Today I'll be talking something about PCOD. PCOD is basically a hormonal imbalance in which the hormone gets looping backward and forward and the female gets entangled into that hormonal imbalance. It is number one cause of infertility and menstrual irregularities, and its prevalence is as high as 30% in the Asian women, and almost 10 million of females in India are affected by PCOD. Now PCOD the cause is multifactorial, and genetics and environmental both play roles in the manifestation of disease. The most common presenting symptoms of PCOD are menstrual irregularities, no period or very scanty periods, infertility, acne and hirsutism and thinning of the scalp hair. Also, Acanthosis Nigricans is one of the presenting symptoms in which there is a deposition of black plaque at the back of the neck and knees and around the ankles. Also, the people who are suffering from PCOD, they are at high risk of conditions like diabetes type 2 mellitus, then hypertension, cardiovascular accidents, even endometrial cancer, that is cancer of the uterus. So PCOD needs to be treated not only for the symptoms which are presenting, but also something which is going on at the back. PCOD is a heterogeneous condition and it is difficult to diagnose. By consensus, any of the two following conditions present is diagnostic of PCOD. The conditions are as follows: presence of anovulation or oligoovulation, that is either the egg formation is not very efficient or it is totally absent. Second is hyperandrogenism, which is high levels of male hormones. And lastly, on ultrasound, the characteristic polycystic ovaries. Actually is happening in PCOD is that there are high levels of insulin. This insulin hormone is very commonly heard when diabetes mellitus is being discussed. But in PCOD also, there are high levels of insulin and the body is actually not insensitive to insulin. What we call the body is insensitive to insulin. Because the body is insensitive to insulin, there are high levels of androgens or the male hormones which lead to oligoovulation or anovulation. That is, either the eggs are not formed or the eggs which are formed, they are not very efficient. Now these immature degenerated eggs, they get deposited below the capsule of the ovaries, and that gives rise to the characteristic feature of the polycystic ovaries. What is seen as oyster pearl ovaries, or on ultrasound it gives the appearance of a pearl string. Coming to the diagnosis of polycystic ovaries. This polycystic ovarian disease, as I said, it presents an enigma and it is difficult to diagnose. The clinical history which is given by the patient is very important. On clinical history, the patient usually says that either there is a very positive family history of PCOD or diabetes mellitus. That is, the mother or the aunts or any of the blood relations in the last 3 generations must be having some menstrual irregularities or infertility. Then presence of menstrual irregularities along with infertility and high levels of male hormones lead to hair in all wrong places, that is the face and the body, and there is thinning of the scalp hair. Then acne and obesity. Also, all these may lead to stress and depression. So the clinical history is very important. Then we come to the hormonal levels. As I initially said, it is basically a problem of hormonal imbalance. The levels of hormones are estimated preferably on day 2 or day 3 of the menstrual cycle. A list of hormones is given by a specialist, which include the GCT or the glucose challenge test, in which we see how the body is utilizing the carbohydrates which are being given to it. Then FSH, LH, thyroid, prolactin, all these hormones are estimated. Then the diagnostic feature of polycystic ovarian disease on ultrasound, which shows enlarged ovaries, and also a pearl string pattern is seen on ultrasound, which are once again those immature follicles which have not become egg. And lastly, laparoscopy. On laparoscopy, we see oyster pearl ovaries and enlarged ovaries. These are the diagnostic features or the diagnostic criteria of polycystic ovarian disease. The medical management of PCOD includes insulin sensitizers to reduce the insulin level. To reduce the male hormones, anti-androgens are given, fertility drugs, then statins. And if the patient is not responding to medical management, then of course finally the surgical management, which is done by laparoscopy. What is done is ovarian drilling. There are 2 or 3 punctures made in the ovarian capsule, and that gives good results in cases which are not responding to medical management. So PCOD can be difficult because it leads to infertility, stress, and the overall appearance. So it can lead to stress, anxiety, and depression. Consult your medical specialist at the earliest. She'll take care.